In this video, we will review the main problems regarding the inequalities in the access to health services in the context of the COVID-19 pandemic in Peru.
The capture of the state in the health sector and equal access. The state capture is the process of influences generated by economic and political elites to make laws or buy them for their own benefit. In the case of the health sector, these excessive influences affect coverage, costs, quality and access to users of different income level, from the richest to the poorest, served in public or private entities. This situation generates market distortions, a fact visible above all in the generation of dishonest prices of medicine and treatments that affect citizens of different economic strata. A serious consequence of this capture by the state falls on the poorest, who are those who need more coverage and support from the state. Also, the quality and moderate cost care from the private system. In this way, institutional inequalities and weaknesses are perpetuated. When this happens, the population ceases to have equal and effective access to health, which is aggravated when major health crises such as COVID-19 occur.
Regarding access to public versus private services, in Peru, entities are responsible for their own financing, and therefore we have a fragmented and unequal system. Private services are well-financed and have affiliates who work in lucrative sectors, while public sector have doubled its number of affiliates in rural areas. The CIS, that represents half of the population, had an annual per capita expenditure of $35. Salud, with a third, spent 5 times more, and the 1% that use private entities expend around 20 times more than the CIS. Obviously, private entities provide good services, while the services of the CIS has a very low level, to the point that 30% of its affiliates prefer to self-medicate. Today, more people may be affiliated with the CIS, but fewer are served. Access to healthcare is more unequal than ever and excludes the growing informal population, which was reflected in the pandemic, with extremely high ICU bed prices and the centralization of vaccination in Lima.
Now we are going to explain the health system context before COVID. The main problems identified are low budget for the health sector, deficiency of health staff, lack of medical equipment, delays in hospital care, and lack of medical supplies. But now with the appearance of the COVID-19, the problem became evident. The main problems that we have to deal with as a country through pandemic are difficulty finding ICU beds, oxygen shortage in hospitals and health centers, inequality in healthcare, difficult access to health services, high cost for treating the disease, and uncertainty about treatment. Also, we have some numbers that are important to say. In Peru, we only have 2,708 ICU beds and 1,990 hospitalization beds. And also we've lost 189,522 people. We have centralization in Lima. Since ever, most medical services such as exams, tests, equipments, as well as specialties and doctors have been centralized in Lima. So, what are the reasons of this? About 30% of the population lives in Lima. The main hospitals and clinics are located here. There are more job opportunities and to grow professionally here in Lima, and also we can find the most recognized universities in which careers related to the health sector are studied. Now we are going to explain how does the medical attention work in Peru in the context of COVID-19. Also an important question is, does people know how much it costs to save their life here in Peru? Let's have a real look. If we talk about the health system in Peru during the pandemic COVID-19, we should consider an interesting fact that is the coronavirus disease has considerable and increasing demand for drugs to manage the symptoms, although there is still no effective pharmacological treatment. Also, this increased demand has worsened the already existing problems related to the supply, availability, and prices of medicines in Peru. Another fact is the lack of the availability of medicines and medical supplies that finally forces Peruvians to go to private establishments that affect their family economy and quality of life. Also, if we consider a pandemic context, we will see people really needed of treatments due to the loss of many jobs and reduction of the household income. Another relevant information is that the illness treatment for meal cases is equivalent to an investment of 1 to 4 days of minimum salary, and the price of the medicine goes from 4 cents to 24 soles. And for several cases, the treatment may require an investment up to 64 days of minimum salary, and the price of the medicine goes from 1 to 40 soles.
The solution. First, greater regulation by the state towards the private sector is required, as well as ruling out public officials with possible conflicts of interest in order to have better public health. Second, the public health system must be restructured towards greater decentralization. Finally, the audits of civil society organizations must be taken into account.